Alright, hi guys. I'm Mackenzie Long and my group focused on rotavirus for our disease presentation. And I focused on the treatment, prevention, and control. Alright, so for the treatment, there isn't any specific medications that can treat for rotavirus, but doctors are able to prescribe medication that can treat only the symptoms. And there aren't any antiviral drugs that can treat this either. And then the antibiotic drugs don't help with rotavirus because they only fight bacteria instead of the actual virus. And then without the medications or anything, usually the infection will resolve within 3 to 7 days. So about a week. And then one of the main symptoms that rotavirus has is dehydration. And this is the #1 priority. They said just make sure that you're not dehydrated because this virus causes vomiting and diarrhea that leads to dehydration. And then children and older adults and other people with other illnesses are more prone to dehydration. And the symptoms of dehydration are a decrease in urination, dry mouth and throat, and dizziness as well. And then in children, you'll notice they cry, but there's not that many tears coming out, little to no tears at all, and even more fussiness and sleepiness than usual, so people have to pay attention to that. And dehydration is the biggest concern that's preventable by drinking plenty of fluids, and rehydrates will restore the minerals that were lost to work more effectively than just water. So since all those minerals were lost from throwing up and with the diarrhea, it gets pretty nasty and they'll have to restore all the minerals that have been lost. And then with diarrhea, if the diarrhea lasts longer than just a few days, then doctors will prescribe oral rehydrates such as Pedialyte, and that restores all the lost minerals a lot better than just drinking water can do. And if the diarrhea is severe, hospitalization may be necessary, and they'll be able to restore the fluids through the IV a lot quicker, so if it's that bad. And then the antidiarrheal medicines aren't recommended for someone with the rotavirus. And then for prevention, rotavirus can spread really, really easily, and even with regular just cleanliness, like showering, things like that, and just hand washing, that doesn't really help because it can still spread pretty easily. And the vaccine is the best way to provide for this, or to protect against this virus. And there's 2 different kinds that you can get, and there's Rotatech, and that's 3 doses given orally at the age of 2 months old, 4 months, and 6 months old. And then the Rotarix, which is the 2 liquid doses at age 2 months and age 4 months. And the clinical trials of both of these types of vaccines are they detected that there was no increased risk of getting this virus after they received the vaccine. And then also there's home remedies with that as well if people didn't get the vaccine and ended up getting this virus. And in babies, you want to offer them small amounts of liquids, whether it be by formula or breastfeeding. And they also recommend that you don't dilute the formula, that you'll just put the rehydrate in there, but that you leave it just the normal recipe on there. And then for older children, you want to encourage them to rest and eat lots of bland foods like soda crackers and things like that, and to drink plenty of fluids plus a rehydrate with that too, and to avoid sugary foods, apple juice, and dairy because that just really upsets the stomach. And then in adults, it kind of goes with the same with the children, where they need to rest and eat the bland foods, and also they can suck on ice chips to help settle their stomach a little bit, and make sure they're drinking plenty of fluids. And they recommended little sips of water, ginger ale, clear sodas or broths, and to also avoid fatty foods, caffeine, alcohol, and nicotine, because that really upsets your stomach and really kind of messes all that up. So that is for the treatment and prevention for rotavirus. So thanks for listening, guys.